Good morning, good morning. What's on my mind? I'm Dr. Dale Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is my daily medical tidbit. I want to talk about some really up to date information that came out this week on blood pressure management. So, the new blood pressure guidelines by the American Heart Association and the American College of Cardiology issued a new set of guidelines for high blood pressure. And the last time they did that was 2017. And this is really the guidelines used by clinicians nationwide. And, the big thing that's coming out of this new recommendation is to limit the amount of alcohol consumption. I mean, we all kind of knew that, but to put it into the guidelines, I think, is extremely important. It found that those who limit the intake to no more than 2 drinks per day, and men, that is, and women who limit to no more than one per day, saw significant changes, right? Both your systolic and your diastolic, the top number and lower number, both increase over time with alcohol intake, and significantly. This was actually published just yesterday, all right? The data found that those who avoid drinking alcohol have the lowest risk for hypertension. And those who reduce their intake by at least 50% experience significant health improvement and decrease in their blood pressures. So the updated guidelines are instructing doctors to recommend treatment to those with stage 1 hypertension rather than stage 2. So don't let it get to stage 2, right? So that's very, very important. The 2017 guidelines really prescribed a lot about lifestyle changes, right? And which medications to use with systolic pressure of 140. Now advised to recommend lifestyle changes, lifestyle changes, lifestyle changes, lifestyle changes, and start treating from one blood pressure of 130 to 139 now, right? So start early before the pressure gets too high and you're going to need more medication. So this is actually good for those who really want to make a difference in coming off the medications and improving their lifestyle. All right, so that's important. So again, I think it's important. The 2025 guideline is for us clinicians to educate you in helping you manage your blood pressure better and reduce the toll of heart disease, right? Not just the heart, the kidney, right? The type 2 diabetes and all these other issues, all right? So this is new guidelines stating that yes, continue to restrict the sodium. That's important. That has always been in there, right? Take it down to less than 1,500 milligrams per day, all right? And the alcohol part is huge because we see too much alcohol being consumed. You can't have a social drink, right? But to be drinking every day, partying every weekend, consuming alcohol has a significant effect on your blood pressure and your heart. Okay, so that is important. Remember, and I have American data, close to 50% of adults in the US have high blood pressure, at least stage 1, stage 2. Okay, so we have to keep talking about these things, and it's higher in us. So dietary factors, right, including the sodium intake, right, and be careful with the alcohol consumption. They're now saying little to none is recommended, right? Continue to take large amounts of fiber, calcium, magnesium, vitamin D, proteins. Less animal protein, more plant-based protein is also good, right? Your age, your obesity, and all these things, sleep, all are affected by all these issues, especially when you consume a lot of alcohol. So again, be careful, and take these guidelines very seriously. So this is shedding light on alcohol consumption. We drink like there's no tomorrow. Too much of it. And young people, right? And I have not even started talking about, alcohol, fetal alcohol syndrome, how your babies are gonna look if you continue to consume all this alcohol. right? And all the other side effects of too much alcohol. I just wanted to put that news out here today because it just came out by the American Heart Association and the Association of Cardiology. Fresh off the press. Watch the alcohol consumption. Have a great day. Peace.